Good morning. No one is safe from a COVID-19 infection, and that's reminded us on a regular basis in our community. We do know that some of our populations are more vulnerable than others. Our nursing homes across the country and here in St. Louis County have been hit particularly hard. These are our mothers, our fathers, our sisters, and our brothers, and their isolation is made even more difficult by the restrictions on visitors that are required to keep them safe. We have 174 long-term care facilities in St. Louis County, and our Department of Public Health is working with them closely to try and keep our residents safe. We are fortunate to have a pool of healthcare professionals, doctors and nurses that work with our health department on our high-risk task force. These are volunteers, mostly retired, but each of them gets a list of long-term care facilities, and they contact them on a regular basis to make sure that they have what they need: PPE, masks, training, other supplies. As a result, St. Louis County has provided over 20,000 masks and other PPE to long-term care facilities. We've also developed a quick response team, and this is a group of health department individuals, epidemiologists, other highly trained individuals who can go into a long-term care facility at a moment's notice whenever a hotspot in our community is identified. They provide training, other resources, masks, other PPE, and they can do a deep clean, and they get in and out in 24 hours. And these folks are available on call on a 24/7 basis. And we're working closely with our regional jurisdictions to make sure that this process is regional and community-wide. Our Department of Public Health has been aggressively developing a testing program, working with our regional partners in our community to develop a testing strategy, contact tracing, and providing PPE wherever it's needed. We are ordering another 100,000 tests, and we'll know shortly when those tests will be available. We continue to have testing supplies every day, and we continue to work with our partners in the community to make sure that everyone who needs a test will have a test. And we hope to be in that position soon. We also have commissioned a testing study in our community to try and understand who has already had COVID-19 infection and what the prevalence of this is. That'll be important in our public health strategy moving forward. We also are working with our public health partners to perform a wastewater study to try and understand how COVID-19 is moving in our community. And we've developed new contact tracing software to make it more efficient to find and counsel anyone who's been exposed to someone who is positive for COVID-19 to make sure they have the resources they need to be safe and they understand how to get care if they need it. This week, we began distributing 200,000 masks in our community, working with our public school officials, social service agencies, to make sure our vulnerable populations had access to masks and other PPE. And by Memorial Day, we anticipate that we'll have another 750,000 masks to distribute in our community. So today I asked Michelle Ryan to join us. Michelle is the director of our Emergency Operations Center. Michelle has been helping us coordinate our COVID-19 response within St. Louis County and with our regional partners in other counties. And she can also help explain how our Emergency Operations Center is working with nursing homes to keep them safe. Michelle?
Thank you, sir. I just wanted to take a minute to just maybe do a little deeper dive into how the Emergency Operations Center is functioning around long-term care facilities. We've established at the direction of our Department of Public Health a high-risk task force. This task force is led by a member of my team. She uses vetted, medically qualified volunteers to make contact with our long-term care facilities on a regular basis. If a facility has at least one case, that contact is daily. If it is a facility with no cases, they contact no less than every 3 days. Through a series of questions, they're able to establish what the facility's needs may be. They bring that information back to the EOC where we can take action. Within that, we're developing the quick reaction teams. This is a regional approach. We're working with our neighboring counties. There will be 2 teams, one in St. Louis County and one in St. Charles County. Deployable for the Departments of Health through MOUs and mutual aid. They come with 4 components. The first is testing, on-site testing when we go into a facility. The second is contact tracing. The third would be a training component. And then, as Dr. Page stated, a deep clean and sanitation of the facility. We are hoping to have these teams in place and ready to go by next Monday. So we still have a little bit of work to do, working out the MOUs and mutual aid agreements, but we are moving forward.
Thank you. Any questions?
Dr. Shelley, did you say that those teams weren't ready to go yet, or they are doing it now, or they're going to be starting to do it?
So we provided some of that service already. We provided some of that service within St. Louis County, and we're getting it more organized to make it more efficient, building those teams and establishing mutual aid agreements with our surrounding jurisdictions, starting with St. Charles County. Some of those services have already been provided.
So the quick response team is already in place?
The quick response team is, individuals have been performing this service. It hasn't been organized into a quick response team, and it has not been coordinated with other surrounding jurisdictions, and that'll start on Monday.
I see, so it's just basically growing more than what it was.
We've been providing this service in nursing homes when we've been called, but putting the structure to it and regional cooperation is going to start on Monday.
Dr. Page, what's so important about that? I mean, you spoke earlier about the vulnerability of these nursing homes. What's so critical about having this kind of team be more organized and be working with other jurisdictions as well? What's key here?
Well, we understand we're still seeing some increased cases coming from our nursing facilities. We know that they are particularly vulnerable. Anyone who lives in a congregate setting is more vulnerable. And then our nursing facilities have patients as individuals who have chronic medical problems and will do poorly with a COVID-19 infection. So there are 2 risk factors here. One is living close together in a congregated setting, and the second is the individual health risks that each person has in a nursing facility. So these are high-risk populations, and moving forward, we're going to be focusing very closely on our high-risk populations, especially those who live in nursing homes and other senior living facilities.
Around how many tests have been brought into our area successfully over the last 2 or 3 weeks? I know you said you had a hope for an additional 100,000. Where do we stand?
You know, I know that we have tests performed by many different groups, our hospital systems, our health departments, and our federal qualified health centers and others that have popped up. One of the things we're doing this week is trying to coordinate those test results, not just right now, a positive test is required to be reported to us. We need to have those tests reported to us more quickly and on a more regular basis so we can interact with contact tracing. We also need to know the number of negative tests that are done so we can watch the positive to negative ratio, because as we perform more tests, we're going to have more positive test results. So we have to watch also how many negative tests that we're getting so we can understand what the true trend in our community is. We're working with all of the individuals who are in the testing space. We don't have a tight relationship there because everyone has moved so quickly to get tests in our community. But our goal this week is to tighten that relationship, to make sure that those positive tests are reported to us so we can answer that question, how many tests are actually being done and what percentage of them are positive. It is good news that more people are performing tests, and it has increased every day.
Can you talk a little bit about, I know we've heard from a lot of people, the cease and desist letter that was sent. What is the what is the next step? I know the gym has really said no. So what is the incentive out there if someone's watching this and saying, well, nothing's happening to this gym, why am I staying closed? What is the county's next action to hopefully deter that kind of activity?
Well, we're going to let the court system work. They have filed their legal position. Our county councilors filed their legal position. And then when the court has made a decision, we'll take the next step. But I think we need to let that process work, and I'm going to let the county councilor manage that. The county counselor is the attorney for St. Louis County.
And Dr. Dick, how frustrating is it to know that you have a gym out there who is operating like this? Is there a concern about the potential for spread there, or what worries you then?
Well, we have 30,000 businesses in St. Louis County, and we will occasionally have those that don't want to follow our advice and instruction, and we'll work through those processes as they identify themselves. But I'm going to follow the direction of my health department, and my job is to protect the health and welfare of the citizens of St. Louis County, and I'm going to follow the advice of our public health officials and the doctors. And they have advised me that the next step in this slow, methodical, responsible, and gradual reopening of St. Louis County is to focus first on the areas where the transmission of COVID-19 can be a low or moderate risk with proper social distancing and PPE. And they tell me that gyms, spas, other gatherings are high risk for transmission of PPE, transmission of COVID-19, even with PPE. So I'm going to follow their advice, and we'll see where this takes us. But at this point, my top responsibility is the health and welfare of people of St. Louis County, and I'm going to be guided by my public health department and the doctors that advise us.
Do you have any further guidance on daycare center reopenings?
Yeah, daycare centers have been open for first responders. We've given them guidance on how to safely operate a daycare center. That guidance has been out there for a while, and we'll have more this week, but we expect daycare centers to be open as they would be. We will have some guidance for them. That guidance has been previously published, and we're going to take another look at that, maybe refine it this week, but we expect daycare centers to be open.
On May 18th?
Yes.
If they're following that guide, okay.
Yes.
I know about the first responder.
Yeah, daycare centers have always been open. They have had guidance to stay open. They've had guidance to safely take care of the kids, and we know that as some people are going back to work, that daycare centers will have to be there. I don't know how busy that will be, because I expect a great deal of individuals in St. Louis County to continue to work from home. In spite of the opportunity on May 18th, many employers have told me that they are going to continue to work from home. People will continue to stay at home whenever possible, and we're going to have a gradual ease in our community as people start moving about more, start looking at our community and deciding whether or not they feel safe to venture out. And we know that social distancing is important. Staying at home whenever possible remains important as we look to manage the COVID-19 infections in our community.
That's what I was going to ask you in the big picture. With the gradual reopening a week away, it sounds to me like you're not expecting a rush, if you will, of businesses opening or customers.
No, I think some businesses will still hesitate as they try and manage the risk of COVID-19 in their place of business, as they try to decide how much volume they will have, as people become cautious and start to measure whether or not they want to be moving about in the community. And we see this all over the country. We've seen it in other jurisdictions. It's not a light switch. It's a gradual movement of individuals who are deciding whether or not they feel safe to come out. And that depends in part on what they see when they move about the community, and it depends in part on the testing environment that we're able to create. And what they're seeing in other places in the country where they have eased some of these restrictions more aggressively than what we have, and they've started to see some cases pop up. And we know we'll have more cases in St. Louis County. We expect that, because that's what happens when you start to ease some of these restrictions. We want to make sure that people who need a test can get a test, and that we can aggressively find contacts of people who've been exposed to COVID-19 and provide them with the advice and treatment that they need.
How much has the county invested in tests up to this point?
I would have to refer you to our transparency portal. I don't know that number. I know that we've purchased a lot of tests. We recently had bids come back a couple of days ago, and we're in the process of purchasing a lot more, and we will continue to purchase tests and as quickly as we can. It's in a very competitive environment right now in our country, and we still have a national testing shortage.
how's our testing situation here in Contra? Is the shortage still just like the rest of the
Well, over the past week, it's really improved. A lot of people have started testing more. We have we have commercial labs, health systems, federally qualified health centers, and others who have started providing tests in our community. And I think that's a good thing. What we need to do is coordinate that testing with our health department, so when someone tests positive, we can find out quickly and get them the advice that they need and the treatments that they need. And more importantly, we can find their contacts, find their close contacts, and give them advice on whether or not they need to quarantine or whether or not they need to be tested. Doug, do you have any questions?
Both of them were about House and what the next action is of the county. I think you've answered that, but if you want to state that again.
Yeah, well, we'll see what the courts do. That's between their attorneys and the county's attorneys. And after the judicial system has worked through the process, then we'll determine what the next step is. And, I would again say there are 30,000 businesses in St. Louis County. Most of them want to know what the safe thing to do is, what the right thing to do is, and they just want that guidance, and they'll be following it. And we will occasionally have outliers like we do with any law, local, state, or federal, and then we'll manage those on a case-by-case basis.
So it's safe to say if somebody were to follow suit, that the county would act similarly with that business as they have with this gym?
Yes, the county will be consistent with how it manages violations of our stay-at-home orders.
Our gyms aren't yet open to clear, they're open on the 18th, yeah, is that correct?
That's correct.
Okay, so there is no date
Yeah.
for them to reopen at this point.
Yes, and we'll, after we get to the 18th, we'll start looking at the trends and testing and hospital capacity and all of those other markers that determine whether or not we should advance our opening, whether we should have less restrictions in our community, and whether the next round of opening should take place. But we're going to watch these trends very closely. We're going to be driven by data. I don't want to pick a date on a calendar and make a statement other than we look at these trends daily, and we're going to make decisions that are responsible and thoughtful and safe and protect the health and welfare of people in St. Louis County.
My last question is, are key people in the county, such as yourself, being tested on a regular basis?
No, we don't test anyone who doesn't have a reason to be tested, isn't symptomatic. We follow all the social distancing guidelines, and there's no reason to test members of my staff.
And you yourself have not been
No.
tested?
Are we good?
Okay, thanks everyone.